If your smile shows more gum than tooth, it has a name and several possible fixes. Dentists call this excessive gingival display. It appears when more than 3 to 4 millimeters of gum shows during a full smile. The same gummy look can come from different causes: extra gum tissue, a strong upper lip, a short lip, or a longer upper jaw. Identifying the cause matters. Gum surgery won't fix a hyperactive lip, and lip injections won't fix extra gum tissue. For extra gum tissue, dentists commonly reshape the gum line, a quick procedure called gingivectomy, done under local anesthesia. When bone sits too close to the new gum line, surgeons perform crown lengthening, reshaping both gum and a small amount of bone. When a strong upper lip is the cause, small botulinum toxin injections can relax the lifting muscles for 3 to 6 months. For longer-lasting lip control, lip repositioning surgery limits how high the upper lip lifts during a smile. In severe skeletal cases where the upper jaw is longer than usual, a maxillofacial surgeon may reposition it through jaw surgery. Recovery varies. Gum contouring heals in days. Lip surgery takes about 2 weeks. Jaw surgery needs several weeks off. All procedures carry some risk: sensitivity, minor bleeding, asymmetry, or gum regrowth if the underlying bone wasn't addressed. A gummy smile is a cosmetic concern, not a medical one. Taking time over the consultation is a legitimate choice. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.